A couple things we need to know first is that we are going to be checking a patient's blood sugar, and a normal blood sugar should be between 80 to 120 milligrams per deciliter when we're reading it on a glucometer. Now, when we're using a glucometer, we should be using this on any patient with a history of diabetes, and then also any patient with altered mental status. Any of those two patients, you guys, go ahead, get out your equipment and check this patient's blood sugar. Now, a couple things we're going to do here is, number one, is we're going to take a look at some of the equipment. Now, we have our glucometer itself. We also need to have our test strips. Our test strips are going to be different for each type of glucometer. This one's pretty easy. It comes with two sides. One side's got like a little barcode on it that gets inserted into the glucometer. The other one has a where the sample or the blood sample will actually be attached to that. We're going to go ahead and we're going to leave that right there for now. We should also have our alcohol swabs with some gauze, and then a safety lancet, which we'll go over. And then most important, anytime we're dealing with blood and body fluids, we need to have our personal protective equipment. So I'm going to go ahead and put on some gloves here. Now, first thing we need to do when we're checking the blood sugar, make sure we have our PPE on. We're going to go ahead, we're going to take our little test strip and insert it into our machine. Now, our machine will turn on. It will also tell you when it's ready to go ahead and accept a blood sample. So at that point, I'm going to go ahead and I'm going to select my patient's finger. Typically with diabetics, they will have a lot of built-up calluses, so I'll try to pick fingers that maybe aren't the ones they'll poke all the time. Typically, the ring finger or the pinky finger are good. I also try to get all the blood down to where I'm going to poke that finger. So I'm going to get it all the way down to where that finger is full of blood at the bottom. You can see my finger turns really pink. I'm going to clean exactly where I'm going to poke it. All right, so I'm going to clean that finger, clean that finger, clean that finger. And I'm going to go ahead, get out my safety lancet. Now the safety lancet, you guys, I don't know if you saw that, it's got an end with the needle. It's also got an end with nothing involved. So that white end, I just twist it off. And now I have this little white area that I'm going to go ahead and I'm just going to push against my skin. And you're going to hear a little click. 1, 2, 3. All right, and that was it. I just pushed the needle in. Now this is safe. Now that needle's not going to poke me. Now if I should be able to get a little blood out. All right, good. And what I should do with that first sample is I should wipe it off. All right, now I'm going to go ahead, I'm going to get my next sample out. Whoops. Get enough blood. We'll go to squeeze it aside a little bit. And then just go ahead and hold that blood right up to your patient's glucometer. It should fill up the whole machine. And it's going to go ahead and give us a reading. Good, so we got a blood sugar of 96. Now that we're done, we'll go ahead and clean off our patient's finger. All right, go ahead and give them a bandage to wrap around their finger. Stop that bleeding. Just a couple minutes of direct pressure will be all that you need. This is now a sharps. It needs to be placed in a sharps container to avoid poking yourself again or poking someone else. Again, it's a safety lancet, so you shouldn't have to worry about that. But we want to go ahead and do that. If we notice we have a low blood sugar, you guys, go ahead and treat as effectively. You can go ahead and assist or administer oral glucose as necessary. Any patient who does have an intake gag reflex, and go ahead and control their own airway.